Hi guys! So unfortunately this video isn't going to be very high quality today because I am using Photo Booth on my computer to record this video instead of on my phone, so I apologize for that. But today I'm going to be talking about my shadowing experience. This last week, for the last 3 days, Tuesday through Thursday, I was shadowing with my dad's friend Greg, who is a nurse practitioner and owns the clinic Best Practices Medical Clinic in Yakima, Washington. So during that time shadowing with him, I really learned a lot, and he was super nice, super helpful. I just followed him around throughout his whole day, 8 o'clock a.m. to 4:30. So he's a nurse practitioner, which is kind of basically the same thing as a family doctor, in which they see patients for a variety of things that they're dealing with, whether it's just like a cold. They'll come in and want antibiotics or suggestions on how to alleviate those symptoms. Or it could be complications with diabetes and they'll come in. Or it could be injuries. There were a lot of people who were struggling with arthritis, or there was this one lady who was clipping her fingernails and a fingernail went in her eye. And so just anything really across the board, nurse practitioners and family doctors take care of. So because he had his own clinic, he had other family doctors and other nurse practitioners working for him. And so it was interesting to kind of see their perspectives also. But basically it was just a clinic where people would, he would see patients and they would bring him their problems and their concerns, and he would address those and either send them off to other medical specialists where they could get their needs more addressed, or send them off to get lab testing, which was very common, to try and see what the problem actually is and get blood work done. Sorry, I run out of breath a lot when I talk, and so I have to swallow and, get a hold of my breath. So just basic family medicine, and that was just basically why I was shadowing him. So when noticing how he interacted with patients, it was really interesting, because he would go in the room, and it was kind of funny. One thing I noticed all the doctors and nurse practitioners doing before they enter a room, they would kind of peek in and be like, knock, knock. They wouldn't actually knock on the door, but they would just say, knock, knock. And I thought that was kind of cute and quirky and a funny little thing that they all seem to have in common with each other. So a lot of the patients that he saw are people that he knows from his community, whether it's people from his church or family friends or just distant friends and relatives. It was interesting to see how many people that he knew personally, and I think that's a reason why he was so successful in building his own practice, is that he already had very well-established connections and relationships with his patients, which was really cool to see. And a lot of his patients were super friendly and open to share stuff with him. And he asked often about family members and how they were doing in their personal lives. So that was really cool to see. Another thing is, when he would first enter a room, he would generally shake their hand, be like, how are you doing? And he would introduce me, because when people knew him, they didn't always know me. So he would say, this is Savannah, she's a pre-med student shadowing with me, and they'd usually be super friendly and be like, oh, hi Savannah, so nice to meet you. And it was cute. I really enjoyed that. And or he would do an introduction, which this didn't happen often, but if it was a new patient and they didn't know him, so he'd be like, "Hi, my name is Greg. I'm the nurse practitioner." And to really get them talking about what was going on and why they were here for their visit, although he did have a general idea, because when they would check in, the receptionist would write a note on his computer, like why the patient was coming in and what symptoms they were dealing with and stuff. But he would always ask, like, "How are you doing?" Or, like, if it was a regular patient, he would be, how have you been with this since the last time we talked? Or he would just, like, encourage them to talk about their symptoms. And then generally the patient would go into their explanation, and they would just try to convey to him what was going on in their own words, and generally they would just be describing their symptoms, saying like, "Oh, I have a headache that radiates across here when I wake up in the morning," and they would just give him all the information, and then he would like be like, okay, like, and then he would ask questions like, "Does it hurt when you go to bed?" and just trying to see, like, maybe get a possible diagnosis or like get an idea of what could be going on. And so so after the patient would go into their explanation and he has a pretty good idea of what's going on, he would like recommend some treatment, or he would just give them the possible options of what he could do. For example, if a patient had a cold that hadn't gone away in like 2 weeks, he would say, "Well, this is what we can do. We can like have you go in for lab and get some lab work done on your blood, and then you can come back and we could look at those results and make a decision on what to do from there, whether to put you on antibiotics or get you in to see an ears, nose, and throat specialist," which was a pretty common thing for a lot of people who like had sinus issues and weren't really sure what was going on there. So a lot of it was just him like trying to problem solve and address and do the quickest and easiest solutions. I noticed one of the doctors, it was funny, he was saying that like if you hear hoofbeats, think it's a horse, not a zebra. So basically what that means is like if you are given a patient with these symptoms, just assume the most common normal thing, because that's typically what it's going to be. Like, it's not often that something rare jumps out. It's usually things are pretty simple and normal, but sometimes that's not the case. But yeah, so it was just a really great learning experience. I really love how Greg has such a good relationship with the majority of his patients and how they feel so comfortable talking to him. And many of them asked him about his family and his kids, which was really cool to see. His son had actually had a lot of medical issues in the past, and so a lot of the patients were asking, "Oh, is your son doing okay?" and stuff. And it was just really like great and heartening to see how many of his patients cared about him and how Greg cared for his patients. And it was just overall a really great experience, and he invited me to come shadow with him again next summer and whenever I want, which is really sweet of him. And his family's also going to go down to Guatemala in the springtime to do like a medical missions trip. And so he invited me to go with them on that. And so I might do that. But yeah, and it was really great. And I really enjoyed the environment of the smaller clinic. I haven't volunteered or shadowed in any hospitals, but I would imagine myself liking that more personal smaller, less corporate environment to work in. And so, yeah, I just really enjoyed my shadowing experience, and I learned a lot. And all of his staff were so sweet and so nice, and all of his patients were so, so sweet. And it was a great experience. I got all my hours in, 21 hours in 3 days, and I would just love to go back and do it again. Yeah. Thank you. Bye, guys.